Hello, this is Mrs. Chidley going over your medication card assignment. So there are a couple reasons why we're having you do this assignment. For the immediate, we're having you do it to help you review the medications that you will be giving during your simulation with Mr. Smith. And for more of a long-term thing, we are giving you this assignment to help you get used to creating drug cards, writing out this information about medications, because starting in Junior 1, you will be asked to do this. You will have a patient assigned and you will pre-assess them. You will find out what medications they're taking and then find this information about them. So I'm going to kind of go through and help you figure out how to do that. Now, you may use a drug book, you may use drug cards, you may use a reputable website. As long as the information is correct, we are fine with however you would like to get it. I'm going to show you in the drug book, and I will warn you, this is an old edition of the drug book, so the page numbers that you see here may not be exactly right, but this medication has not changed. So lisinopril here, I'm going to show you some of these things. So we're looking for classification, the action, which I'll show you in a second, the uses, route and dosage. For this, you'll put your, moving forward from here, you'll put the dosage that your patient is on. But for Mr. Smith, you're going to put the dosage he is on, and then you can do a range of the usual dosage. You'll be talking about side effects, and just a note on side effects here. Anyone can have an anaphylactic reaction to any medication. So what we're looking for here are things that are unique to these medications, something that we really want to look out for with these types of medications. And then nursing implications. This is often patient teaching or things that we need to look at as nurses. So let's look and see what this looks like in the drug book. So you look for your drugs. Here's lisinopril. These are going to be in here or should be in here by their generic name. So here's lisinopril. These are some of the brand names that go along with it. So its class, its pharmacologic class is an ACE inhibitor, an angiotensin converting enzyme inhibitor. It is indicated for hypertension. And here is some of the dosages. It is given PO, and here are dosages for an adult. Then if you come over here, here's the action. It causes a decreased production of the angiotensin II and suppression of the RAAS. Some adverse reactions. These are all adverse reactions that your patient could have. You feel free to list as many as you would like, but you do not have to list everything here. Two things that are common with, or more common and seen with this medication specifically, are this dry, persistent, tickling, non-productive cough. This can just be slightly annoying to patients, or it can be so bad that they have to come off the medication. Another one is angioedema, which means swelling of the face and around the throat. And so this is a very serious reaction, and they would immediately come off the medication, call the physician to immediately come off the medication. They would also probably need further evaluation if they are experiencing angioedema. So those are ones that you definitely want to watch out for side effects. And then on the next page here, we have nursing considerations. Once again, you do not have to list everything that is on this list. So nursing considerations then goes into patient teaching. So this is what goes in your nursing considerations. Some of these things here, as well as some patient teaching. Like I said, please, you do not need to write everything that is in this section, but just go through and pick out the things that you feel are most important for the nurse to be seeing and for the patient to learn. So it is somewhat of a time-consuming activity, especially when you first start doing it. But as you start doing it and as you work on this, the more you do it, the easier it becomes, and you start to notice trends in the information that you're finding. Also, give you a little hint, we do not want you to reinvent the wheel. So if you have lisinopril this week and you have lisinopril next week, we don't necessarily need you to make a new drug card. We just need you to save the one that you have and bring that information over. What we care about is that you know about the medications, not exactly when you wrote the drug card. So I hope that's helpful. If you have any questions about this assignment, please reach out to your instructor. Thank you.